So I want to just touch upon some of the points that Dr. Hiller brought up and talk to you about long-term career options in emergency medicine. So I think all of you in this room are pretty excited about this option, and this is a really good thing to be excited about. This is the stuff that we will be doing for the majority of your career, and it's definitely something that hopefully you've been able to experience through observerships in your first year rather, and starting to get into your clerkships now. So you're probably all sitting here thinking, well, okay, great. So now that I've finally gone through this whole process of deciding what field I want to go into, and I've decided emergency medicine, why are you telling me this? And one of the points that Dr. Hiller brought up is that when you're looking for programs, you actually want to look at location, what's going to work for your family, but you also want to consider your long-term career interests if you've thought past emergency medicine at this point, because that can definitely help guide you into some programs, and you might actually start to consider some programs that you wouldn't have looked at otherwise. And Dr. Hiller already talked about the combined programs. And then talking about some of the ABEM recognized subspecialties. And the question is, well, now that I've decided I'm going to do a fellowship, should I do one that's ABEM recognized, or should I do one that's more of the non-traditional ones? And that really comes down to where your interest lies. I think more and more of the subspecialties are being recognized by American Board of Emergency Medicine. And when something is recognized by ABEM, they may or may not be the body that administers the certification exam, but they all the medical bodies, medical specialties rather, work together to come up with a combined certification. If you're somebody whose interest happens to lie in this, you get an extra piece of paper, but otherwise you're definitely continuing your education, broadening your career options, and that's definitely something to keep in mind as you are looking for a fellowship, considering your fellowship options. Critical care is one that Dr. Stoll talked about extensively. There are actually two pathways for emergency physicians to go through. One is through anesthesia and one is through American Board of Surgery. And they have slightly different requirements based on which pathway you choose, but at the end, you do get to do critical care. And a lot of people, more emergency medicine physicians, are going into critical care, and you can actually do a lot with this fellowship. Some people choose to split their time, as Dr. Stoll did. Some people do only critical care. One of our current EM/IM residents is going into critical care and plans to only do critical care. And I think depending on what kind of practice setting you're going to end up in, ultimately can help decide if you're going to do a 50-50 split, if you're going to do more one department or the other, or exclusively emergency medicine. For those of you who have done rotations in the emergency department already, have you seen a lot of critical care? Yeah. So you realize that extra training in critical care, if you do only emergency medicine, is only going to help you as you go through your EM career. So definitely something to consider if that is your area of interest. Any EMS, former EMTs or paramedics out here? All right, so a few, yeah. EMS is another fellowship that's gaining popularity within emergency medicine, a lot of administrative potential in this realm, a lot of research potential as well. Most EMS fellowships are 1 year. There are a variety of different programs. Some are tactical based, which is kind of very much an adventure for those who are the former paramedics, and some are more administrative based, but definitely a lot of options in this subspecialty. Anybody done any kind of hospice or palliative rotations in med school? Good, that's excellent. I think this is something that as emergency physicians, unfortunately, we are faced with on an almost daily basis. I don't know about the other attendings in the audience, but I know I'm constantly amazed when we get fairly end-stage and fairly advanced cancer patients who have been through chemo and radiation, and their oncologists have never addressed end-of-life care. It's heartbreaking for me as an emergency physician to have that conversation with the family, but I think it's something that is unfortunately a reality for us, and extra training in hospice and palliative care rather definitely can come in handy. Actually, one of our current third years is going into a palliative critical care fellowship, so it's definitely something that emergency physicians are getting into more often. Toxicology, again, something we come across on a daily, if not hourly basis during a shift in the emergency department. I know a lot of the toxicologists are leading the projects to try to come up and address the opioid epidemic. I know Dr. D'Onofrio's talk yesterday, if anybody saw that, just highlights how prevalent and how widespread toxicology is and how much this is a part of our daily practice in emergency medicine. This is a fairly prolonged fellowship. It's a 2-year program. Some are actually 3 years with a research year. But if anybody can flash back to biochemistry and organic chemistry in undergrad and all the molecule structures, this is the field for you. I came from a toxicology heavy residency program where they also joked that one of the requirements to be a toxicologist was that you had to try a lot of the illicit substances that you then study. So If anybody has wild undergrad days as well, this is something that might be more interesting to you than some of the traditional specialties. Again, very similar to the whole opioid crisis is the role of emergency physicians in pain management and pain medicine. This is something that more and more emergency physicians are going into, and anybody who has seen 2 patients in the emergency department knows the role of pain management in emergency medicine. So this is a very wide open area right now for emergency physicians. Pediatric emergency medicine, as Dr. Hiller was saying, the combined pediatrics emergency medicine residencies are a great way to get into this, but also I know talking to some of my pediatric EM colleagues, they actually love when they get emergency medicine applicants rather than pediatric applicants to the fellowship, because we have a very different approach and a very different mindset to dealing with sick children, to sick patients in general, but children in particular. And this is something, again, that a lot of research is out there, and a lot more with the movement to have more specialized emergency departments. Pediatric emergency medicine is, again, coming to the forefront of emergency medicine. Sports medicine is something that I am a little bit partial to, as I've mentioned before. I think, again, this is a subspecialty that's been primarily dominated by family medicine, but more emergency physicians are getting into sports medicine, which I think is great for the field. We do have, again, a different mindset than the family practitioner when we are on the sidelines. We're much more familiar with the acute injury and the traumatic aspects of sports medicine than the family medicine physicians are. Any NBA fans out here? Yeah, so the medical director for the NBA is actually an emergency trained physician, and Major League Baseball now has 5 emergency medicine trained physicians on their medical board, so we're definitely making progress. Underseas and hyperbaric medicine, again, much more prevalent on the coast, and in Pittsburgh we use it a lot more for burns and for wound care. But again, if you're thinking, again, a way to get to the east or the west coast, might be your way to get into academic emergency medicine. Definitely a common fellowship. And then there are all the non-traditional options, which is not to say that they are not important, because these are, again, if you look at this list, these are things that we do, again, on a daily basis, but you're not going to get the nice fancy piece of paper that says you completed a fellowship, and you're not going to say you're double boarded or whatnot for those who care about those things. Ultrasound has, I know Nick had to step out for the education research meeting, but they have an extensive ultrasound program at Ohio State. I know that's something that even if you're thinking community medicine down the road, a lot of more community hospitals are trying to develop ultrasound programs. So this is a nice academic or administrative rather role that you can have in your career. Administration is everywhere. I know those of us who are in residency administration can shake your heads, but at the amount of paperwork and computer-based surveys and whatnot that we fill out, but this is, again, a role, and with the increasing emphasis rather on metrics in the emergency department, something that is definitely going to be highlighted. And a lot of these administrative fellowships are nice because they also have, as part of the curriculum, is an MBA, so that can help you significantly as you're going through the rest of your career. Quality assurance is, again, something that's tied in with a lot of the metrics, and a lot of these programs also have the MBA component as well. So if you want to have Dr. Stahl be your mentor and see if you can get more titles than he has, that's a good way to do it. Again, there's a whole move in emergency medicine towards the specialized emergency departments. I know geriatric emergency department certification is something that's becoming increasingly common, and geriatrics emergency medicine fellowships are becoming increasingly common by that same stretch. Any computer people out here? No? Okay, nice. Medical informatics is another area that's booming. The EHR has taken over medicine, and I think there are a lot of different applications that way. So if you do have a computer background, this is a nice way to actually develop your niche and to further your career that way. So at the end, thank you for coming today. It's great to hear that and see that so many people are considering emergency medicine. And yes, emergency medicine is great, but it's kind of thing, it's like emergency medicine by definition is kind of, we do a little bit of everything. And the fact that we have this many fellowships and this many further training options kind of goes along with the whole nature of emergency medicine. Definitely consider your interests, and it's one thing that you might be sitting here thinking, oh, I want to do ultrasound, and then you get to your residency and you realize, wow, I love geriatrics and I want to do that. It's okay to change your options, or it's okay to do multiple fellowships too. So definitely keep your options open, but it's good to know what's out there. And definitely addressing, kind of tying things together. If you think, well, do I really want to do a fellowship? Is it really worth it? It's a whole similar to the 3 versus 4 year thing. If it's something you're really interested in, you really want to further your education, it's definitely worth pursuing, and there are ways to make it work. So, any questions? Yes?
So I kind of heard a contradictory statement today that I've been advised on previously is don't select a residency program based upon the fellowship that you want or that you consider doing.
Mm-hmm.
What are your thoughts on that? Because today it was stated that it's easier to do an EM residency where they have a fellowship you're interested in just for the sake of not moving or ingratiate yourself with the program.
Right. So it's a little bit of both, to be honest. I think if you do think, using sports medicine as an example, since that's the one I'm most familiar with, there aren't that many still EM sports trained physicians out there, so it's good that if you know, like, hey, I think I want to do sports medicine, I'm going to go to a program where we have some EM sports faculty. It's a little bit trickier when you're talking about the ABEM boarded specialties, because some of them, sports medicine, toxicology, pediatrics, it's actually a match. So regardless of whether or not you're at the program, it doesn't necessarily guarantee you entry that way. For some of the non-traditional fellowships, it does make it a lot easier to just stay, especially for ultrasound. I know that's one that a lot of people end up staying at their home institution for. So it's a little bit of both. I think it's good to go to a program where they have, say, an EM sports person so you get the exposure. And again, having a letter from an EM sports trained physician when you're applying for fellowship will help more because, again, emergency medicine is a small world, but a lot of these, the subspecialty worlds are significantly smaller, so having a letter from somebody who's in the field will help you a lot. So,
I think it depends a lot on how convinced you are you really want that to be a big aspect of your life. So if you're just interested in exploring toxicology, boy, I wouldn't use that to define where I go in a residency. It would just be a small refining thing that I would put into the decision makers. If you really knew I'm going to be a toxicologist, you're dead set on it, then it's probably going to carry a lot of weight. It really would heavily favor how you pick your residency.
and just, and that's a great point that Dr. Morrissey brought up. And just speaking from personal experience, I kind of went into residency knowing I wanted to do sports medicine, and I went to a program that did not have any EM sports people and had really never heard of it, but it was at a big enough university that they actually were able to set me up with the Department of Orthopedics, and they were very willing to work with me and do what they could to help. But I think the biggest thing is to actually go to a program that you like and that you feel comfortable at. Other questions?
I think it's very hard at this point in your career to really know what you're going to be super interested in 4, 5, 6 years down the road. I'm sure there are a few laser-focused people here, but boy, you're going to get exposed to so many different things over the next 3, 4, 5 years, and doors are going to open in walls that you didn't even know existed, in buildings you didn't even know existed at this point. So keep your options open.
You may not you may not think that the program you're at for residency, even if they have a fellowship in what you want to do, you may find out that you actually like the way they do the fellowship at this other place. And even though you had the fellowship, and that's why you chose your residency, you ended up going around somewhere else for fellowship. So I agree. I wouldn't hang your hat completely on fellowship in order to determine where you go.
Yes.
How important is it that I get boarded in what I do my fellowship in?
It's absolutely, that's a great question, and it's really not important at all. It depends, with a few exceptions. I think toxicology, they really want you to be boarded. For sports medicine, if you want to work at the professional level or the international level, they actually want you to have the certification now. But for the other ones, it really doesn't matter much at all. Like I said, I'm not much for the piece of paper. I think my med school diploma is still at my parents' house. I'm not quite sure. Yeah, like unfortunately for hiring purposes, some people really do care about that piece of paper, but yeah. Any other questions?